retention, work schedules, career ladders, and pathways. Now, people want to know that when they go work somewhere, that they're going to have the ability to build a career, that it's not solely just a job. Now, it may start off that way, but if we want to retain them, we need to give them the opportunity to build a career, to move up, to have flexibility. It is so fundamentally important to have that. So as you can see on here, when we talk about work schedules, so at baseline, flexibility is key. And it really is a fairly low-cost strategy to use in order to retain, but also to recruit individuals working at your health center. So of course, it's very difficult sometimes when you need the clinical coverage, the on-call coverage. So these obviously have to be priorities, and the level of flexibility that you can have is probably going to vary position by position. However, there are many advantages to the part-time, the flexible, the hybrid, the remote work schedules. And one of the biggest things too with this is that we're doing this now with the pandemic. You know, a lot of health centers, whether they were ready or not, they had to do it. So it's going to be much harder when people see how well it worked to come back and say, no, we just need to go back to how we were before. That idea of the 9 to 5 in the office workday doesn't really exist anymore. So it's very important to keep this in mind. And it also goes into the conversation about benefits. Like this really can be offered as a benefit. And when you're recruiting people, put it in your job announcement that you're offering this, you know, as a retention tool. And also talk to your staff, because some staff, they really do want to be in the office. They want to be there. They want to be engaged, you know, be in that kind of brick and mortar building. And that is incredibly important for them. Others, they want that flexibility of, you know, come in certain days of the week, work from home. And then others may want to be completely remote. What you're able to offer is really going to depend on your health center, but you need to really not overlook these key areas. And especially if you've already been doing it, it's been going well, and you suddenly push people back who are not ready to go back, or who feel like they can, you know, they really are excelling in doing this work remotely. It's going to be really, really hard to convince people, because there's always another organization that's going to say, okay, well, then we will do it here. You know, this is especially true. So I'm a social worker. My focus is really on behavioral health, and that's what I've had a lot of my training in. For a lot of behavioral health providers, and I don't know if we have any in the room today, doing the remote telehealth has allowed them to make even stronger connections with a lot of their clients and their patients. Now, this is not always the case, and that is very complicated based on, you know, is the patient safe at home? What are the, so, and I'm not going to, that's not what this conversation is about. But the reason that I'm saying this is, it like really refueled for them that passion, that mission that they were having. So we have to think about, you know, offering these opportunities that'll give people what they're looking for in the workplace. So as I said, the 9 to 5 workday has changed. I really, you know, it hasn't really even just changed. It really just doesn't exist as much anymore. Hybrid and remote is really no longer an option. It's an expectation. And I know that seems so like, okay, well, how are we going to do this? Well, you're already doing it. So you have the skills, you know. We learned so much during this pandemic, as we're still going through the pandemic. We can make things work. We can't make it effective. We can do this. And we can ensure that people have that work-life balance, which is part of the work schedules they're building. So embrace those generational differences as a huge part when it comes to this. You know, understand this is a benefit and how it positively impacts, you know, especially single parents, people with different needs. When we're looking at individuals in the workplace who live with a disability, working from home may make a huge difference. So someone with a physical disability, being able to be in a place that is just much more comfortable for them. You know, they can excel in that, being in their home. Individuals that may struggle with certain mental health issues such as anxiety, having the space to go home, work from their place where they feel safe, and they can produce excellent work through that flexibility students. So this is another thing too, when I talk, and I'll talk about career ladders in a moment, but supporting the people in your workforce to take the next step in their career, many times also means them in going to school while they're working. And that can be of so much value because you're allowing them that flexibility, but you also know that you have someone great in the workforce that is ready to take that next step, and they already care about the health center and hopefully will stay there. Now, it's really important that you develop policies and procedures. You write them down, get input from staff, but make sure that people are aware of exactly what your policies are regarding hybrid, remote, telework, anything like that, because you want it to be equitable across the board. Or if there's going to be differences, for example, if this is an accommodation that's being made for someone under ADA, then that needs to be written down. Not, the person's accommodation, but that some accommodations will be for that reason. So you just have to make sure that everything is done correctly, keep track of those legal requirements. So if you have remote staff, what are the different tax implications depending on the state that they're in, because you'll have to file based on the state where the person lives. And then also the remote work needs. So when someone is in the office, they're going to need supplies. They're using the internet, computers, all of that. Think about offering those stipends. Because if they were in the workplace, they would still be purchasing it through the company. So it really should be no different if they're working remote. So these are just some key areas to think about. So as y'all can tell, I really like using these audio moments. So I just want to play a quick 4-minute audio from NPR. And this is basically people sharing why they left. And if you notice, a huge part of it is the flexibility of the workplace. So let me go ahead.
More and more workers are saying, I'm done. A record 4 million people quit their jobs in April, just as employers are facing labor shortages. NPR's Andrea Hsu looked into why this is happening.
Jeremy Gombieski got his first restaurant job at 16 as a dishwasher at a Big Boys. He's worked his way up over 26 years.
I love being a host for people. I love getting people food, making people happy.
But the pandemic took the joy out of his job as the general manager of a breakfast place in San Diego. There were days when just he and the cook were handling all the takeout orders. And when indoor dining resumed,
every hour or so, I would have to argue with somebody in the front who didn't have a mask.
Sure enough, last October, he got COVID and then brought it home to his whole family.
I'm pretty sure that I got it from arguing with somebody at work.
In December, California went into lockdown for a second time, and he was furloughed. The time away opened his eyes to what life with the family could be like if he didn't have to put in 50 to 60 hours a week at the restaurant or work on holidays, especially Thanksgiving and Christmas.
I want to see my 1-year-old and my 5-year-old's faces light up when they come out and see the tree and all the presents that I spent 6 hours at night assembling and putting out.
So when he got called back to work last week, Gombieski quit, putting an end to his unemployment checks, which had been a cushion. He and his wife figure they have enough savings to last a month or two. So she told him, let's find something you're happy with. He's open to jobs in retail, maybe data entry. But one thing's for sure, he only wants to work 40 hours a week.
I think that this is clearly a real phenomenon where more workers are quitting than we've ever seen in the past.
Daniel Jal is a labor economist with the job site Glassdoor. He says in normal times, high quit rates are a sign of a healthy labor market.
They signal that workers feel more confident in order to actually leave their jobs and find a new one.
But right now, he thinks there are all kinds of reasons people are quitting. Some people may have just waited out the pandemic to leave a job that wasn't a good fit. Some people are quitting because they can make more money elsewhere. Professor Sidal Neely of Harvard Business School is focused on yet another factor. Thanks to the pandemic, she says, workers now feel empowered to speak up about when, how, and where they want to work.
We have changed. Work has changed. The way we think about time and space has changed.
And for a younger generation of workers, that could mean entire careers that look nothing like they would have before. Take Jonathan Caballero, a software developer working out of his basement in Hyattsville, Maryland.
This is kind of where I set up with screens.
He has 4 screens in his home office, also a whiteboard and a guitar.
When I'm tired of looking at the screen, I just pick it up and...
Music, he says, has helped him get through the pandemic. Caballero took this job last year knowing he'd someday have to go into the office. Now, with that day approaching, he's decided he'd rather not commute 45 minutes each way in a car he'd have to buy.
Yeah, I don't think I want that anymore.
He's only 27, but in the pandemic, he noticed his hair was thinning. He thought to himself, I need to start living.
I mean, I haven't really been through much of the U.S. or the world. All the time I'm always wishing, maybe I wish I could be just working by the beach or something like that, and maybe after work just go swim.
Now, he's not uprooting yet. He owns his home and is working to fix up his backyard fence for a dog he got in the pandemic. But a couple months ago, he began looking for a job with better remote work options and soon had multiple offers. He settled on one and now is just waiting on a background check.
I think the pandemic has changed my mindset away, and I really value my time now.
Yes, he says, there are bills to pay, but also life to enjoy. Andrea Hsu, NPR News.
Okay, sorry about the echo, everyone. I have not muted my phone, and then I was trying to hide the phone because of the echo, not realizing I could have muted. So apologies on that. So as you can see, basically, it's just people want to have flexibility in the way that they work. Now, another thing that's incredibly important is that they have career paths, that they know that they have professional growth, that they have advancement. As I was talking about supporting those individuals who want to go back to school, it's so difficult to recruit MAs, but for many of them, they really want to take that next step. So why not support them as they go through that, wanting to be, a nurse practitioner, a PA, a physician, social worker, therapist, whatever it may be. It's so important to provide that support because you already have someone who's invested in the health center, and you're creating that ability for them to come back and really be that pipeline and just, support the growth and advancement that people need. Now, in those development strategies, it's all about investing in your workforce. And we've talked already a little bit about this, but as you develop that professional development, that continuing education, mentorship, any of those programs, and wherever you offer them in the health center, also make sure that you're highlighting the needs of BIPOC individuals and other underrepresented and diverse groups. And so BIPOC is Black and Indigenous people and people of color. So, so many groups have just simply not had the advantage of their day-to-day life of having professional development, of having mentorship, so make sure that you're creating those connections for them and that they are the individuals who are also leading this for others that are coming in. Also, experience is just as important as education. Some professions, you obviously have to have a certain degree, but don't get caught up in that for all types of positions, especially when we're thinking about the C-suite, leadership, those type of things. And ultimately, and I really do want to read this, is that, Career Ladder is that investment, to train a diverse and inclusive group of employees for the successful and equitable achievement of leadership positions. There really shouldn't be a cap of where your workforce can go. So one more breakout group. This is the last one for the day. And just as we did before, we really just wanted to talk about this. How is this working in your health center? So we'll provide in the chat the same to the link to the Google Slides and to the document. And then we will go ahead and send everybody over to their breakout groups. Oh, and thank you, Mariah, for putting that in there. I unmuted myself from both, able to do it correctly this time. So I say we switch it back around, or maybe we can just start in the middle and kind of, you know, go a little crazy with the numbers. So why don't we start with group 3? And that's actually the group I was in, so I think that's why it popped in my head.
All right, I'll share out for this one. So I think one of the biggest things we discussed is Ashley put it, lack of staff. I think it makes it very challenging when you need staff to be having direct contact with patients, especially when patients are coming in the door, and we've decreased the amount of telehealth visits we're having. That's made it really challenging. And it looks like for those staff, it's harder to provide remote options. At my health center, we do have remote options, but it's really more for staff who don't have to have direct patient contact, like our referral coordinators and our billing staff. We also discussed a lot about like the flexibility of the 410s and the 312s, and that's unfortunately not something that we're currently providing. And then I think we all agreed that there is a lack of upwards mobility right now for a lot of frontline staff or staff in general. We did discuss a couple of things that could be done for things like that, such as creating like a lead medical assistant position where they can be more of an advocate for the rest of the team and really kind of providing them additional education opportunities for their own growth and development as well.
Thank you. And yeah, I thought that was such a great idea of, you know, the growth and development may not be there at the moment, but maybe we could provide it for those specific teams of having their own leader who is really like the advocate for, we talked a lot about it regarding MAs, of having, you know, like the lead MA kind of be able to manage all those things and building positions like that. So thank you so much, Carolina. And let's go to group 1. And who would like to share from group 1? So I see we have Pepper, Carrie Ann, and Brandy.
This is Pepper. I'll share.
Go ahead.
Okay, let me get back up. Okay, so the first one is have 13 clinics in 7 counties in rural Arkansas, and therefore have a great need for staff and providers. When they do have turnover, they have to get creative with coverage, which doesn't leave room for flexibility. So I think it's pretty much the same across the board. We do cross-train, but scheduling challenges impact their ability to be flexible in terms of allowing folks time to go to nursing school or something like that. Terry says they do have staggered work schedules for staff right now. During the beginning of the pandemic, about 85% of the staff did work from home. A lot of those folks now say they prefer to do in-office. The clinical team alternates to allow for that flexibility. And then limited opportunities, recently created an executive branch in the organization, but before that, those levels weren't as established. Mostly there were cost of living raises, etc. And Brandy says right now they offer flexible schedule for providers, but not other staff at this time. That is something we like to look at in the future, but like Pepper said, like I said, with staff shortages with clinical staff, it's hard. They do allow nurses to leave early to attend RN school. They just recently established a remote work policy, but it's not realistic for everyone. They do try to allow staff to take off as needed for family functions as much as possible if staffing allows. And they always try to promote within if possible. Danielle said if they were able to if they were able to fill their clinical position, some of this would be a lot easier. There are places where the flexibility could be offered if they were. Previously, they were in a hyper growth mode. So there are so many new positions. So trying to find time to organize a program and create that continually around it, working on it, but it just takes time.
Okay, wonderful. Thank you so much, Pepper. And yes, completely agree. I think what everyone is saying here is just common across the board. But also, I like how everyone really is so unique to the challenges of their own health center, and how can we be creative with that? And of course, healthcare was one of the hardest hit industries, so the flexibility in the way that maybe other places may be able to provide other industries is not the same in healthcare. So let's go to group 2. And then who will be sharing? Or I see Kimberly and Michael. I know, Michael, you shared a lot, so you're welcome to share again, unless Kimberly, if you prefer, please jump in.
So I'll jump in, thank you. So everyone on our staff, we work 40 hours a week. It's organization policy. MAs have been a challenge to retain because no flexibility. I don't know if I would say MAs have been a challenge to retain. I just think sometimes the candidates as a whole could be a challenge because of the inability to be flexible. So we've had to at some point go to a temporary or temp to perm basis. Obviously the number of candidates are receiving is probably not as much as we would. Other employees, sometimes come to me and say that we would like a hybrid change, or we'd like to start maybe at 8:30 and work a little later, or work a little earlier and get off a little earlier. But there's just no flexibility right now. So it's a challenge that we have yet to overcome. Our CEO's rationale for it is that we're actually supporting the medical staff and the physicians and everyone that's in the medical sites. So if they're working from 8 a.m. to 4:30 p.m. Monday through Friday, then we are here to support them as well. And what are some of your challenges regarding ladders at your health center? I don't know if we really have challenges per se. Our company does give us $1,500 per year for continuing education reimbursement. And like I was saying earlier, I'm so happy to say that some of our CMAs are now health clinic managers, and some of our PRs are health clinic managers. And Michael gave an example of one of our colleagues, Glenda, that started out as a PR, a patient representative, and she was going to quit because she didn't see, any advancement, and she wanted to get in HR, and she's in HR, and I think she's been here for 2, maybe 3 years, but now she's received her certification. I think it's her SHRM certification for HR. So we do have advancement and people can take advantage of it. It's just that I've learned that about 10% of the company do take advantage of it, and it's in our employee handbook. So it's there. We just need to be more consistent and take advantage of it across the board. One last thing, I don't think there's, if you start as a PR or if you start as a CMA, I don't think there's any procedure that's written where you have to take certain steps. I just think it just depends upon that individual and what they'd like to do, but there's room for advancement here.
Wonderful. Thank you so much for that. And I see that there was a question in the chat from Patricia. So Patricia was asking if that CME, the $1,500 that y'all offer, is it for every employee?
Correct, it is.
Okay, wonderful. That is great. And I think goes back to that. Oh, sorry, go ahead.
I'm going to jump in. That is awesome. For her opportunity too. For our providers, they receive $3,000 in CME reimbursement per year as well.
Wonderful. And Patricia, I think you may have just been saying that's awesome, but I want to see a little bit also.
Yeah, I'm trying to put something into place because right now it's just our mid-levels and up in our organization, and I feel like it's leaving opportunities for the rest of the staff out. And I was thinking a lower number, but I feel like that's really generous for every employee in the organization. So kudos to your organization.
Thank
Yeah,
you.
and Michael, thanks for, oh, yes. Thank you, Kimberly. And I just want to say also thank you for Michael to add that part of for the providers, it's 3,000. But yeah, I think it goes back to just that equity component as well of what you offer one group really should be offered across the board, because people really do appreciate that. You know, they just feel like, okay, I'm also a valuable member of the team. Obviously, there's always a cost involved, but I'm just going to keep saying throughout, the turnover is going to cost much more. So that's always a great number to bring to leadership. Okay, so we have, I go through everyone? Did I miss group 4?
I think 4 still needs to.
Okay. Sorry about. I shouldn't have gone out of order because now I was like, oh, which group? So who from group 4 would like to present?
I'll present. We had a really quiet group this afternoon. There were some people on there, but nobody was speaking. But we realized that patient-facing employees really can't work from home, and you know it's hard to make everybody happy. In my organization, what we tried is we actually added bodies with less hours. So not as an HR professional, not my favorite thing to do because I want somebody working 40 hours. I'm going to give you benefits, but we were having a hard time with burnout. So we added bodies, less hours. We also added pay differentials for Saturday hours because nobody really wanted to work Saturday. So if you do work a Saturday, you get an extra monetary amount. If anybody else from my group wants to jump in, I think that was the gist of what we talked about. And then regarding career ladders, having a small health center, this was Heather, there's not a lot of room for growth. And I have a small health center too. We have about 130 employees. And it's true, there's not a lot of room for growth. I mean, we've added supervisor positions and lead positions, but Heather's thought process was shifting from like a 4 to 5 year plan to a 2 to 5 year plan, knowing that maybe you'll get, you know, good two years of somebody, especially if you have a teaching type facility. That was really interesting to me. And then in my organization, I put in a training platform for our PSRs, and I'm working on that for also our MAs and our DAs. And we have videos for them to watch. We have training manuals. We have competency tests that they take to pass a tier, and then it's attached to a monetary increase. And that's actually kept our turnover down to a bare minimum. And the only people that are leaving are people that are moving out of town or going to school or something, not because they're dissatisfied with work. So giving them that extra knowledge has been keeping them up there. But also talked about was like more intentional career paths and succession planning. I know that my company isn't very good at doing that. I'm looking at strengths and interests and not just finding somebody that's in the organization to fill a role if they're not strong candidates. You know, especially for like a supervisor position or a manager position, if you're not going to give them those tools to succeed as a manager, you might have some extra turnover.
Absolutely. And especially, you know, I love what you said about that, because you may make that career path, but when someone moves into that, you know, management position, they haven't been there before. And if you don't give them the tools, you know, people need that support, you know, and also with leadership. When you look at the leadership positions, you know, are there just a bunch of education restrictions, for example? So I know with physicians, obviously you have to have an MD or DO, all of these just different, oh yes, and we're about to go to a break, so I was about to say that. I just wanted to kind of wrap up everything. And yeah, don't think that everybody is going to stay forever. The 2 year, 3 year is a great mark to look at, especially with the new new generation. So let's go ahead and take a 5-minute break. Let's come back at 3:20, and then we'll wrap up for the day.